Oropouche virus outbreak in 2024 is getting attention because it is spreading quickly in Central and South America, especially in countries like Brazil, Bolivia, Peru, and Cuba. Cases are being reported every day, so this virus is something we should all know about. It is often confused with the flu because it has similar symptoms, like fever, headaches, and body aches. While most patients recover without complications, sometimes cases can be complicated, bringing fatal complications such as swelling of the brain. Today we shall explain in detail everything you need to know about Oropouche virus, how it spreads, what symptoms to look for, and most importantly, how to keep oneself and loved ones safe. Before we start, remember to subscribe to Fit Vista for regular updates on the most important health information. So, what is the Oropouche virus? The Oropouche virus is also known as Oropouche fever. This is an infection caused by a virus that is usually transmitted through midges and some species of mosquitoes. These insects flourish in the type of warm conditions such as the Amazon basin and now Cuba, which are viral hotspots. The virus was not something new. It was first identified in Trinidad way back in 1955, with there being outbreaks in different parts of South America since then. In recent years, the virus has changed, which helps it spread more easily, even in cities that are far from the forests where it first lived. Often, Oropouche virus symptoms are similar to flu. Therefore, it is probable to be overlooked. People infected with the virus experience fever, which will begin abruptly, strong headaches, pains in muscles and joints, and sometimes rash. Some other people report that they are sensitive to light, experience eye pain, dizziness, and a feeling of nausea. The symptoms usually appear 3 to 10 days after infection by an infected midge or mosquito and can last as long as 3 to 7 days. The catch with this virus, however, is that its symptoms sometimes disappear only to return a few days or weeks later in some individuals. These recurrent symptoms are typically less severe, but are highly disruptive nonetheless. In more serious cases, the virus causes inflammation of the brain, encephalitis, or the thin layer of tissue that surrounds it, and the spinal cord, meningitis. These problems are rare, but can be dangerous. If the person is getting confused and cannot move their neck and keeps vomiting, it might be a sign that the virus is affecting the brain and the spinal cord. This also may need medical attention at once. Pregnant women must be very careful as it causes the passing of the virus from mother to the baby, which can lead to miscarriage, stillbirth, or birth defects like a small head. However, the big question is, how does the virus spread? As stated earlier, the chief vectors of Oropouche virus include midges and mosquitoes. These insects lay eggs in stagnant water, thus outbreaks commonly occur in places prone to rainfall or poor water management. Midges are minuscule, smaller than mosquitoes, and can pierce through ordinary clothing. That makes them very dangerous to see as it is very hard to escape. The virus spreads when the sick insect bites someone, allowing the virus to gain entry into the bloodstream. Once in the body, the virus grows and can move into other organs, such as the brain and liver. A critical fact is that Oropouche virus does not spread directly from one person to another, so person-to-person transmission can be ruled out. But viruses can be unknowingly brought by travelers returning from areas of outbreak. This is when local populations of insects become infected with the virus, spreading it even further in places where it has not been previously found. The virus is spreading rapidly, especially in places such as Cuba and cities outside the Amazon. It shows that preventing it is of extreme importance. Unfortunately, there is no specific medicine or vaccine that is known to treat Oropouche virus. This means that the best way to prevent getting infected is to keep yourself away from insect bites. Using DEET or picaridin-impregnated insect repellents is the way to go. These are reputed to repel midges and mosquitoes. Apply them on exposed skin. Apply them most especially when it becomes evening and at night, when these insects are known to be more vigorous. The right clothing is also very important. Midges are small enough to pass through thin clothes, so one should wear long-sleeve shirts, long pants, and socks as frequently as possible. A lot of protection can be added in treating clothing with the insecticide permethrin. People staying or traveling to areas known to have outbreaks should also sleep under fine mesh nets. Reticular mosquito nets will not do the job because midges are very small in size, so fine mesh netting needs to be bought for effective protection. Another important step in prevention is reducing the number of insect breeding sites around your home or travel accommodations. Midges and mosquitoes lay their eggs in stagnant water, so it's essential to eliminate any standing water that might collect in items like buckets, tires, or bird baths. Even a low amount of water is enough to enable breeding by these insects. If you have a place or places on your land where water collects after it rains, then consider grading or draining them so that breeding is halted. The threat it would give is even more considerable to the pregnant. As stated above, this virus is transferred from mother to child, and this may bring very severe problems. For pregnant women, it is advisable to not travel to places where Oropouche virus currently exists. However, if one has to travel, all safety measures must be adhered to. Such measures include the use of repellents, treated clothing, and indoor resting at peak biting time. Pregnant women should also sleep under fine mesh nets to preclude any chance of being bitten while resting. Travelers returning from outbreak areas should be vigilant about monitoring their health. If you've recently traveled to a region experiencing an Oropouche virus outbreak and developed symptoms like fever, headaches, or joint pain, it's important to inform your healthcare provider about your travel history. Early diagnosis is essential for managing symptoms and preventing complications. Blood tests can reveal whether it is present. There is no specific treatment, but knowing one has the Oropouche virus can help doctors in the correct care of the condition. This includes controlling symptoms and paying close attention to signs of worsening of the disease. Speaking of treatment, since there is no antiviral drug specifically for Oropouche virus, the primary approach is symptom management. Most people get better at home with rest, fluid intake, and over-the-counter pain medications such as acetaminophen to help reduce fever and relieve muscle aches. Do not take nonsteroidal anti-inflammatory medicines such as aspirin or ibuprofen without consulting your doctor first. These medicines may increase the risk of bleeding if you have any other viral infection like dengue, which presents similar symptoms. Staying hydrated is also crucial, especially if you're experiencing fever or vomiting, as these symptoms can lead to dehydration. Rest is equally important to allow your body to fight off the infection. Most people recover within a week, although for some people, the disease may continue to relapse. Monitor your health condition in the succeeding weeks following an episode of illness. You must immediately consult a physician if you have confused states, stiff neck, or persistent vomiting, as this may be manifestations of serious complications like encephalitis or meningitis. Thanks for watching us on this very important topic. If you found this information helpful, please like the video and share it with everyone who should know about the Oropouche virus. And subscribe to Fit Vista for health updates and a few more tips on how to keep safe. Stay informed, take precautions, and care about your health.